Hello everyone, today I am going to teach about intestinal tuberculosis. Before moving into the topic, let me explain what is tuberculosis. Tuberculosis is a bacterial infection which is caused by Mycobacterium tuberculi. There are two types of tuberculosis. The one is pulmonary tuberculosis, the another one is extrapulmonary tuberculosis. Pulmonary tuberculosis means the bacteria affecting the lungs alone. Extrapulmonary tuberculosis means if we are not treating the pulmonary tuberculosis properly, it will lead to extrapulmonary tuberculosis. The bacteria will spread to other organs like intestine and brain. Intestinal tuberculosis is a form of extrapulmonary tuberculosis caused by same bacteria involving the GI tract, especially the intestine, and also it will affect the abdominal lymph nodes, peritoneum and the abdominal organs. Abdominal lymph nodes protecting abdomen from microorganisms, peritoneum which is a covering of our abdominal organs, and it will also spread to abdominal organs. Here is the image of intestinal tuberculosis. There are four types in the intestinal tuberculosis. The first one is tubercular lymphadenopathy. If the mycobacteria affecting the abdominal lymph nodes means it is called as tubercular lymphadenopathy. If the bacteria affecting the peritoneum, which is a covering layer of our abdomen, means it is called as peritoneal tuberculosis. It will also presenting with ascites. Ascites means fluid accumulation in the peritoneum. The third one is gastrointestinal tuberculosis, also called as intestinal tuberculosis. The bacteria will affect any part from esophagus to rectum in the GI tract, but it is most commonly affecting the ileocecal region. Ileocecal region is a region between small intestine and large intestine. Next one is visceral tuberculosis. If the bacteria affecting the abdominal organs like liver, spleen, pancreas means it is called as visceral tuberculosis. Next we are moving into pathogenesis. The first step is entry. The TB basically entered the GI tract via two routes. The first major route is ingestion of infected sputum. If the person is swallowing the infected sputum means it will travel through the GI tract and reach intestine and cause intestinal tuberculosis. The another major route is hematogenous spread via the blood. If the patient is having a trauma, cut injury, if the bacilli enters through the root, or it will spread from pulmonary tuberculosis via the hematogenous spread, it will reach the intestine and cause intestinal tuberculosis, and it also spread through lymphatics. Next step is invasion. Once the bacteria enter, it invade the intestinal mucosa, especially lymphoid tissue, to lead granulomatous inflammation. The third one is progression. Once the bacteria invade, then it will start to grow. They will spread from mucosa to submucosa and cause caseous necrosis. Necrosis means tissue death. It will lead to intestinal tissue death and also spread to other deeper layers, adjacent lymph nodes and peritoneum, covering layer of our abdomen. There are many causes for this intestinal tuberculosis. The major two causes is Mycobacterium tuberculosis, the most common cause. It will only affecting the human beings. The next one is Mycobacterium bovis. It is a rare from contaminated dairy. If the animal is infected, Mycobacterium bovis means if we are drinking the milk or food from that animal means it will lead to infection. There are three routes for this infection. The one is swallowing the infected sputum from secondary TB, in hematogenous or lymphatic spread. The third one is ingestion of contaminated food or milk. Here is the image of Mycobacterium tuberculi. Clinical presentation. The most common symptom is abdominal pain, seen nearly all patients. Next one is abdominal distension, swelling in the abdomen. The bacteria will alter our bowel habits and leads to constipation, diarrhea and altering patterns. The major symptom of this particular condition is weight loss, fever and anorexia. Abdominal tenderness, visible peristalsis occasionally, peritonitis will also present, inflammation of the peritoneum. There are many investigations. First we have to do clinical suspicion for endemic areas. Next we are moving into imaging, ultrasound CT to visualize the intestine structure, endoscopy to visualize the internal structure of our intestine, laboratory test and culture to detect the bacteria. Next we are moving into management. The major surgical management is exploratory laparotomy. Here is the image of exploratory laparotomy. The surgeon will do a midline incision in our peritoneal cavity to assess the abdominal organs. Then the surgeon will identify the intestine or ileocecal region, the most common region affected by this bacteria. Then the surgeon will identify the affected bowel and he will remove it. Next is ileocecal resection. The another surgical management method. The surgeon will create a margin in the ileocecal region 5 to 10 centimeter. Then he will identify the affected part. If the lymph nodes are also affected, the surgeon will remove the lymph nodes also. Here is the image of intestinal resection.